instructor will come. You will come into a beautiful lobby area where you'll be escorted through the lobby and to our elevators. Right here is one of our brand new hand sanitizing stations. We have these all over every one of our campuses, and they are for your use at any time. So I'm going to go ahead and sanitize it up. Push this button on my elbow. So your instructor will lead you and your classmates in the elevator up to your lab. So let's go. Oh, I need to push this. These elevators are also wiped down and sanitized multiple times during the day. So there's hopefully no risk for exposure there. Man, that sanitizer is like,
it's going.
Good stuff. I got one.
And it's moisturizing.
It is. It smells delicious. Okay, so I'm taking you up to the 3rd floor. This is where our hospital lab is, where we have more, another hand sanitizing station right there. Woohoo. So this is where our hospital lab and all of our health science classrooms are. For the most part, what we're talking about tonight are the phlebotomy and the clinical medical assistant programs. So we're going to come down here. You can see there are restrooms for men and women close to the lab, so you won't have to travel very far. So we're going to go right in here. This is the hospital lab. We have one of our instructors for our medical assistant program, ready, willing, and able to give us a little tour of what it looks like.
From a long view so that they see what it looks like from the outside as you're passing by.
Oh, yeah.
Oh, okay.
The whole setup of the class.
Yeah, it's a very, very large room. Typically would accommodate a class of 24 students, but we are limiting all of our labs to 6 students right now. So 6 students and 1 instructor in a room that would normally hold about 24 students.
So if there's a class of 12, we're splitting you into 2 separate days, 2 separate class meetings.
Which also means you get more one-on-one time with your instructor, by the way. Okay. All right, so this is one of our medical assistant classes. Miss Connie Tapato is the MA instructor, and she's going to walk us through what it looks like when you arrive for your class every single time.
Okay, in our class, the first thing we do is get our temperature. So we go directly, as soon as the students come in, they take their backpacks, and everybody has an area to fly your backpack to the back of their class. You're going to take your backpack, out of your backpack you're going to get your pencil, and you're going to get your red folder. In that red folder is everything you need for class and lab. So we'll go directly to this area that you're assigned. Each student will apply their red folder right by the table, and each student has their own table, so they're spaced out. We do maybe 3 on this side, 3 on this side. We have a smaller class, so it's like 6 students per class. If we have 8 students, it would be 4 and 4. So we try to keep it small so we can give them direct space. Everybody have their space. 1 student is assigned to do temperatures. So let's go ahead. She's going to go directly into the scrub room, wash your hands, get ready.
the students wash their hands and put on new gloves after every encounter. So if they touch supplies and pretend like a student is their patient, and then they move on to the next, they're gonna wash their hands and put on new gloves every single time, and we have ample supplies to do that. Lots and lots of hand sanitizer, hand soap, and gloves available for everyone.
We also have masks, and the students are wearing masks the entire time, throughout the entire course of the class. The instructor is also wearing masks.
And every student will be seated at the designated seating area, and they have to get their temperature before we go any further. Every student, as soon as they come into class, temperatures are mandatory. We get our temperatures, we know where we are seated, so we all are in the same seat for every class. So if we hear on Mondays, we know where we seated, so no one will go get in someone else's seat. If you hear on Wednesday night, the same, you're assigned to that seat. The student take the temperature.
And Ms. Tapato, what temperature are you looking for?
Oh, I want the class to
Oh.
jump in on this one because this is very important. Elizabeth,
Should not be more than 99.
we do not want it if it's going up higher, like 99.1.2. That's an alert. That's letting us know. That's letting us know. Okay, so we're gonna do that. Once she's completed with her patient, which is one of the students, she's gonna take her gloves off. Give me the reading immediately.
It's 90.2.
90.2. So when she gives me the reading, she got the clearance to go in and get ready to scrub and get ready. So go on in and scrub up. Okay, so she's ready to go. So every student has to do this, and we go from there, we go back and forth. Now, Lauren is ready to go once you scrub up, and this is our supplies. Everything is right here for each student. So on our board, so students would not be wondering what to do, where to go, and we write seated in our area. We have our red lead folder. Everything is written on the board. All the supplies they need for the order for Dr. Ray Smith is right here. One student come up at a time and get what they need. Once they finish, wash their hands, go back, and get ready to take and do their procedure. If you have a procedure that's 2 or 3 patients, because you'll have another doctor, you have to do another procedure for another patient, you're going to take and go and wash up, get yourself ready to do the next procedure, okay? Wash up, it's mandatory. Stay your distance, it's mandatory. And you can do it. You can do it. We have our sharps containers out for you so you don't have to be wandering all over. Everything is right there for you. Now, who have a tray that's ready? You've got a tray. Let's get 2 trays ready so the students will know what we're doing. So when you get your trays, you get an injection tray and you go in and get a venipuncture tray. Okay? Go ahead. So everything is right here. They go get what they need, wash up, and when they wash up, they come out and get what they need. They go right back to their section with the trays, and everything is right there in front of them. You're keeping your distance and the flow, and I'm right in here with you, going around and making sure and talking the whole time, making you get through this, and you'll have a great class.
Can you talk about the number of times students get to practice each procedure so that they're feeling confident and ready to move on to the next stage?
Oh gosh, it's meant for my class. I like a student to at least do the venipunctures at least an average of 15 to 20 venipunctures. It's according to the size of the classroom. So if you have 6 students in a class or 8 students in a class, you can at least get 20 venipunctures because you're gonna do your exchange tubes. Sometimes you may obtain blood, you may not. You may get blood, you may not. But the procedure is what we're looking at. Now, another thing I wanna engage in is the injections. Every student have to do, in my class, at least an average of 25 to 30 injections or more. But once you got your injections completed and you got time, you can keep going. Keep on doing practicing because we practice. Practice make perfect. So we're gonna continue. Let's get over here to the injections. This is an injection. She got everything sitting here, ready to go. So that student do not have to go any other place. Sharps container is here. The needle and syringe is here. Alcohol, swab, and 2x2. Band-Aid and the solution.
Which
The
limits
medication.
The amount of time that students are walking around, having to go and pick up products for their procedures. So everything at their station's already ready to go.
Ready to go, ready to go. And we keep a can on each, once they're done, they know we have the cans right there, place them in the trash. They know what goes into the sharps container. We do that from day one. What goes in the sharps container, what goes into the trash. So once they're done, I will not allow a student to have a tray. Once they have done it, it has to be picked up, tossed, whatever needs to be tossed, wiped down to get ready for your next patient. Okay?
Can we talk about the setup of the Zoom classes for this particular course?
Okay, Zoom class is a lot of fun. Let me go ahead and get something that I use in Zoom. Let me go get it, if you can.
While she's doing that, let's just take a recap of all the safety precautions that we have here. Number one, everybody's wearing masks. Number two, all the hallways and the elevators are wiped down, and we have sanitizing stations available for everyone. Number three, we limit the class sizes here in the lab to about 6 students, so that promotes social distancing and also gives you as the student more one-on-one time with the instructor. And Ms. Tapato and the other instructors do a really great job of setting up the lab before the students get here so that you know exactly where to go and what to do. So there's not a lot of walking around and wandering around and wondering what to do and having to ask what to do. It's very clearly written on the board so that you can get straight to work. They take everybody's temperature. They're looking for everything to be under, what did they say? 99 degrees, in order to let you as a student stay. Everything gets wiped down multiple times. I know you heard it. Everything gets wiped down, new gloves, and everybody's washing their hands multiple times every time you come to lab. And that includes over here, all of our clinic tables get wiped down. We have paper for all of them. All of the diagnostic equipment, the EKG machines, and the thermometers get wiped down as well.
Mm-hmm. And if you notice, as we were walking in, they are the only class on this floor. We don't have several classes going on at any given time, so there's less risk for virus, infections.
Yes, the only classes that we are having on campus right now are lab classes. There are no lecture classes on campus, so the number of students and people in general in this building is kept very, very low to make sure that there's less risk for everyone. Where is she? Still getting stuff ready. So for this particular course, the instructor gives the lecture and the discussion time via Zoom during the class time, and then depending on the class size, a portion of them, about 6, will come into the lab time on one day. The rest of them will come on another day. So it's very split to make sure that the students get exactly what you need for lecture, online, and all of your hands-on stuff here in the lab.
And can we hear from some of the students about what about setup makes you feel safe?
So the first thing is mask is mandatory, and one more thing which I like is nobody cannot enter just like that. Only the professor will let us in and let us out. So it is like so particular. And as soon as you enter, the temperature and the social distancing everything looks so great and so comfortable for us to work here.
Okay, good.
Okay, we're gonna go back to Zoom class.
Yes?
When I pulled this out, this is Zoom class. In Zoom class, it's just like if we're in class. Because we have like for nutrition. For nutrition, y'all remember this?
Yes.
Yes. We have the portion size, and we look at the portion size in Zoom, and we go over everything that we're eating, like the beans and the protein and the carbohydrates and the size. We have the plate. So we discuss what the lesson is giving us. For an example, if we're in shirt pad and our assignments is on nutrition, I like to have illustration. And I like to ask a student and discuss it. Discuss what we're doing on our portion size. And I like them to tell me, what is a protein? And then I would say, is this protein or is this protein? And I like the students to interact with the class. And I try to make sure everybody in the class is participating. But Zoom class is good. What did you guys like about Zoom class? Somebody tell me, but Zoom. What did you like?
We're able to like write notes and stuff as soon as we're on computers and can share it with everybody in the class.
Yes, that's one thing. That was one thing we did in Zoom class, and we discuss everything we do, and I make sure at the end of Zoom that every student in that class, I say their names. Make sure they got something out of the class. You know, whatever our topic is, we go over exactly what we're going to be doing today in that class, when our discussion question is going to be on the forum, so they won't forget discussion questions. I love discussion questions. So we know in Zoom we discuss our discussion questions. We discuss anything that's in the announcements that we're getting from the campus, or anything that our administration team is telling me to post on the announcements. We letting everybody know what's going on. And we interact. Everybody interact with each other in Zoom. We do that for everything on illustrations. We pull out syringes. We pull out tubes. Because if we're talking about the subject, I want them to see what we're doing. What we're doing in class. If we're talking about medications or urine or whatever we're doing, I have so many little samples that we have that we discuss in our class. Okay?
What is the end of day procedure? After each lab is coming to an end, what are the procedures that you guys are doing to sanitize and make sure that the class is ready to end?
Okay, who want to go and start with that? Who want to, because they all can give you a little input. Go ahead, Yesenia. What we do?
We wipe down our tables, our trays we've used. We wipe down everything, the tables back here, everything we have to wipe down.
Whatever we use for that day have to be wiped down and sanitized. If we go over here, if we go over to the scales, anything we use have to be wiped down. For every procedure, it have to be wiped down. For every patient, have to be wiped down. But at the end of the classroom, everything have to be sanitized and clean. We put everything on a tray. Things that we know we're gonna use, we put them up and have to be sanitizing and put up. And I'm the only one that get and pull the supplies up because we don't want too many hands. But remember, everyone have gloves on. I told them this is mandatory. You have gloves in your hands and a pair of gloves in your pocket.
Okay. Well, thank you guys so much for sharing. We appreciate the information. We will let you all get back to work, and we'll take this in the hallway.
Now we have to take and pick up our trays, guys. Thank you, guys.
Thank you.
I
They
wanted to
did
point one
very
other thing
good.
out. Normally, this door would be propped open so that nobody has to use the handle. And if you remember, the door to the scrub room was already propped open, so no one's having to use handles here either. So I just wanted to share a little bit more information about our phlebotomy program. We do have 3 schedule options this fall. We have a morning class, we have an evening class, and we have a Sunday class. Just like the medical assistant program, there's a pre-admission application. We need all your vaccine records, your background check, and your drug screen. But feel free to email us or call us with any questions that you have. We're happy to do one-on-one advising. What else?
And we have 5 different sections of our course. We have a course morning, afternoon, evening, as well as weekends. We also have an accelerated program that we have that will be on Mondays and Wednesdays also. We also have the pre-admissions applications. We require the vaccines. If you're interested in having a copy of our PowerPoint presentation that has a voiceover, please contact me at kbradley@collin.edu, and I can get that over to you and any other information that you might need. We look forward to working with you and seeing you all soon.
Bye. Thanks for watching.